In the tapestry of life, where every thread holds a story, America in black and white emerges as a haven for the voices echoing through the heart of our communities. In this podcast, we wade through the rivers of our collective experiences, celebrating the vibrant hues of change brought forth by the whispers of hope and the roars of action. It's more than just a conversation. It's a journey into the heart of our society, illuminated by the light of those daring to dream and do. Join us, and let your voice be the melody that guides us toward a dawn where every color finds its place in the masterpiece of our shared destiny. Together, let's paint a future brimming with the positives that dwell in our minds and the actions that shape our world.
Good evening, ladies and gentlemen, and welcome to another episode of America in Black and White, where we discuss the issues that plague the underserved and marginalized communities and how we can best represent, build, expand, motivate, and excite the people of those communities. Tonight, we have a very special guest. We have Mr. Amari Johnson. Amari Johnson is a dedicated healthcare leader and family man with a strong passion for mentoring and community service. He thrives to become a healthcare CEO and specializes in process improvement, consultancy, focusing, and optimizing operations and driving meaningful change in healthcare systems. Amari has earned a bachelor's in business administration and a master's in healthcare administration from Southern New Hampshire University and is currently completing his doctorate in healthcare administration at Walden University. He is happily married to Brianna Johnson, and together they have two children, Aiden, 6, and Lauren, 4, who inspire him daily to lead by example. Amari serves as the district chaplain for the Bartow County Boy Scouts Association, where he mentors young men and fosters leadership in his community. With his strong foundation in healthcare administration, a commitment to process improvement, and a heart for service, Amari is dedicated to making a lasting impact both professionally and professionally. Amari's long-term goals include becoming a healthcare CEO, expanding his expertise in process improvements consultancy, and empowering communities by mentoring the next generation of leaders. He also aims to inspire excellence through sustainable business ventures, community service, and impactful healthcare innovation. Ladies and gentlemen, I introduce you all to Mr. Amari C. Johnson. Welcome to the show, sir.
Hey there, how's everybody doing? I want to first off, Charles, say thank you for having me on. It's definitely a privilege, and I'm just happy to be here with you and just be able to share the same space.
Yes, sir. Also, is there anything you'd like to add to your bio before we get into the show?
Charles, I think you covered everything there. Let's see. Other than kind of the work that we do here in the community with the Boy Scouts and just here in Bartow County is pretty much where I'm based at. So we do a lot with the county. We do a lot with Atrium. So I just love being involved. If you're here locally anywhere in the Rome or Bartow County area, you'll probably see us partaking in any kind of parade that we're having in the community, or probably just out eating with the family. So I'm just as about as regular as anybody else, and I just really just enjoy getting out and having a great time and just being able to network and meet new folks, especially young people like myself who are just having interest in anything.
Well, I definitely appreciate that, and I'm glad that we've got you as a guest because, you know, in these days and times, I mean, talking healthcare means a whole lot and is very valuable for people in the underserved and marginalized communities. We're going to jump right into, the first topic that we like to talk about is healthcare access. So can you tell us what inspired you to pursue a career in healthcare administration?
Absolutely. So, Charles, growing up in just a thriving household of it was me, my father. I also grew up in my grandmother's household. You know, although I lived with my father, my grandmother, a mother of 9 kids, her house was always full. So that was my second home. Just like anybody else's family, we had kind of like just a good amount of members who just really had health issues. Being able to want to help, want to have an impact in that, it didn't really hit me until I got a little older. I just kind of realized my father, once he was diagnosed with cancer, it didn't hit me that, I wish it was something I can do. At this time, I was already about 27, right? And I was like, it's not much I can do from the professional standpoint of where I was. I was a business major. I didn't go to school for business administration during that time, but during that time, it made me realize I want to go ahead and shift education to where I can have an impact on those who are impacted by their health and those who are looking for answers that we quite don't have yet. And I feel like we start and we end with health. So healthcare is where I wanted to be at that time.
Oh, wow. I'm sorry, to hear about that situation, because I do know, especially when you talk about cancer, that could be very devastating, because my mom just passed last June, with cancer. And, that's a bit much. How do you ensure equitable access to healthcare services in your role?
Absolutely. It starts by communication. We are all entitled to the same access of healthcare. However, are we all entitled to that same information? Are we accessible to being able to hear the same thing that we're able to hear in other communities? So healthcare professionals and the healthcare organizations are trying to ensure that they're not only in the community, but they are also connected with their community. It takes a lot more of that to be able to make sure we spread awareness to being able to take care of yourself. Instead of going to the ER, we want to make sure we let folks know, hey, let's go ahead and set up primary care appointments. Let's go ahead and get to know your doctors. Let's go ahead and start being more aware of how to prevent, these care gaps that arise in not only just Black communities, but with all communities.
Mm-hmm. So can you tell me, so as an administrator, and we talk about this access to healthcare, is this before or after people have insurance, or how exactly does that access work?
Absolutely. So for those who lack health insurance, there are plenty of healthcare organizations out there who are not only here to advocate for you, but also here to show you the way of, hey, here's how you go about getting affordable healthcare. Whether it's going through Marketplace or maybe even potentially going through your employer, there are several avenues of just being able to be educated on how to go ahead and make sure you have access to just the best quality care. I think it all starts out by making sure, for one, you are insured. And at the end of the day, if not, we want to be able to show you different avenues you can probably take to go ahead and make sure you're paying less out of pocket. A lot of times we're all familiar with those prescription savings cards that come in our mail. Most of those are pushed by community advocates and companies who want to make sure that you, every time you go to your local pharmacy, that you're not spending a lot of money on those prescription drugs. So our goal is to make sure not only do we educate you all and those out there who are unaware of how to go ahead and get affordable health insurance. Not only do we educate them on that, but we also make sure that we do a lot of different local gatherings out in the community where you all can come to not just our organization, but other organizations, and sign up for those kind of care plans. So it's hard to be that action step, but we make sure that at the end of the day, we can be in your neighborhood and make it as easy as possible for you.
So tell us this. When let's say, like, we know, as you mentioned, people can get insurance like via their job plans, or they can go out through the healthcare exchange. Are there other places that people can actually go and search to find healthcare insurance?
Absolutely. So if you don't feel comfortable for what you see on the Marketplace, or let's just say your employer rate is a little bit too much coming out your check, you have full access to to get on your browser and look at healthcare plans that best fit you. A lot of times it will point you towards the Marketplace, because I think I advocate for it strong. That's where you go to be able to whether you take a survey or whether you put in different filters that best match your situation, they will help you find something that's not only affordable, but fits your family and you pretty well.
Okay. So what are the biggest challenges you face in improving healthcare access for underserved communities?
I love that question. I believe in order for us to have the most impact, the challenge starts with trying to, not trying, but to be in the right place at the right time. And as we all know, there can be a huge time crunch in our schedules, whether it's just because we're going to work and dealing with our kids, or just, maybe we just don't have access to get to where we want to get to have that impact. Me and my wife, before we came over to Cartersville, Georgia, we lived in Atlanta. Atlanta has a very high population rate of uninsured individuals. But what I also seen was that there were plenty of people out there advocating why you should go ahead and make sure you're covered, and also ensuring that you had a way to sign up for those coverages. The biggest gap that we face, and what makes our job a little harder to making sure we can make that connection with the community, is that a lot of times we're not where we need to be. And the biggest problem is because, for one, we have to market how we're going to get there. We're going to market where we are going to be. We got to make sure that we're, most times you hear from a lot of different companies and organizations during community gatherings, whether it may be a parade, a block party, maybe you're meeting at your local football games or what have you. We try to find the best way to meet the community where they are. That's our job. It's to make it easy for them to come to us. But the biggest challenge is sometimes being able to make it to every event, and also being able to just be in the area where you can go ahead and push that information out.
So let me ask you, when you've done your work via community, and we just think about healthcare in general, when we and just staying here where we're talking about the underserved communities, how has that looked in the past few years as to not only just the coverage, but the health of the individuals in those communities? How has that looked over the past 5 years?
I'll tell you, I believe we're getting a step closer to where we need to be every year. What we do, we make sure our providers and our medical team, whether it's an MA or front desk, reception, etc., local primary care, urgent care, and even emergency room, help you realize where you need to get to and how you can better take care of yourself. We educate our medical team on how to better educate our community on how to take better care of themselves. Doing that, I can tell you that we unfortunately don't have the stats in front of me, but I can tell you before I came in today, looking at the quality side of things when it comes to just my profession itself, working with Atrium, we see that our numbers between our patients grow when it comes to more people getting checked out for maybe cervical cancer screenings, breast cancer screenings, and what have you. We ensure that we educate them when they're coming in for just, maybe somebody came in for an ear infection. And hey, while you're here, we're in your chart, and we see that, it's probably a good time to schedule a mammogram. We would advocate that you go ahead and do that, and we can get you in during this appointment. How does that sound? It's not always up to your patient to say, hey, when can I come in for a mammogram? When can I come in for a colonoscopy? We have to also remember that in the healthcare industry, we are advocates for you. It's our job to let you know when you can come in for your nearest service. So doing that, we've seen numbers improve. We've seen numbers grow upward. We can do a lot better, and we're aiming to do a lot better. But it all starts with us. And it also starts with us making sure that we are involved at a community level.
Wow, well, that's definitely a good thing to hear. Can you share a success story where you significantly improved healthcare access for a community?
Well, I'll tell you, so I'm very new in my current role with Atrium, so I haven't been able to kind of put my boots in there and get to work just yet. But with the Georgia Guard, I have had a privilege of working under a what we would call a medical NCO. Our medical NCO is responsible for ensuring that everybody in the Georgia Guard is lined up and ready to receive their care when it comes to when we do our annual training. During that time frame, we also lead into SRP. It's a soldier readiness program to ensure that we have all of our shots, where our dental records are up to date. So what I've done to pretty much help us do what I've done to ensure that we can fulfill those care gaps is to look out. I've reached out to soldiers. And there was a point in time where we had a lot of outdated records. In order to update those records, you got to get in contact with soldiers. And I think around this time, I've had to reach out to at least about maybe 50 soldiers within my first week before going into SRP. We had a huge success. We went in there and we made sure before we not only did our annual training that we were ready and just ready to go ahead and smash it, but we also ensured that we educated those soldiers about why it's important to get these care needs filled. And we also educated them on how they can go ahead and not only do it on the military side, but when you go back home, here's how you can keep up with your chart. Educated them about my chart, which a lot of people are aware of. And we're trying to make sure that we educate not only our civilians, but our soldiers on how to be better care advocates for themselves and their families. So that was a pretty big success.
Okay. How do you address the social determinants of health in your work?
I would say currently right now we do, we're all numbers. So I work with a great team of individuals. And from day in and day out, they're all in meetings. We're all in meetings. And our care team is interacting with us day in and day out to figure out how we can better improve healthcare and those social determinants, as you mentioned, of our patients. What we do is we ensure that we get a chance to reach out personally, reach out to the patients, and we educate them. Now, you'll hear me say back to back, education is what it takes to improve care. So I'm always going to say we educate. I think we cannot have the impact in healthcare for our community if we don't let them know what's the risk. You'll hear a lot of times at Atrium, we talk about preventative care. I think that's our bread and butter. In order to prevent, potentially missing cancer, not getting Cologuards, we have to educate not only our team, but we have to educate our patients. So to fill these care gaps, we reach out to our team, we reach out to our patients, and we let them know the best route to go. And we also talk to them and let them educate us about a little bit of their family history. And we take that very seriously as far as how we can prevent many care gaps that they have.
So as we're, like in this early part of the interview, can you just tell our audience what is the most important thing, or what are some of the important things of knowing why they need to have access to healthcare?
You need to have access to healthcare, more so, especially if you have a family. It's important in general because you have to take care of yourself. For example, it's me, myself, my wife, and we have 2 children. If I'm not taking care of myself, I can't take care of my family. And so I think that's the priority for most of our communities. Whether you're a mother, a father, a grandparent, what have you, we gotta carry on for our families. Not only that, but a lot of times we're doing a lot of great things in our communities. And in order to continue to push a good social change, we got to take care of ourselves. So a lot of times we get a little selfish. Sometimes we come home and we go, oh man, I got an appointment coming up at 2:30. I don't know if I feel like going. I just cancel it. And a month down the line, something happens. Maybe there was a stroke you could have avoided. Maybe there was some eating habits you could have, cut back on to cut down on, hypertension. If we're not seeing about ourselves, then we're going to cause a bigger problem down the line. And, unfortunately, sometimes that can be, death. We have families. And at the end of the day, we have impact in many people's lives and in our community. So we got to just be more aware of what's going on, and we got to ensure that we're taking care of ourselves. So I'm going to always advocate that at the end of the day, it's not about you. You know, my old boss used to say, it's not I and me, it's about us and we. We got to remember that. It's not just a you thing. You have to see about yourself. You got to get taken care of.
So what strategies do you use to increase awareness and utilization of healthcare services?
Oh, social media. I love getting on LinkedIn, and I love sharing information on LinkedIn, Facebook, Twitter. You name it, we're going to find our way to go ahead and advocate and push out. You know, as time goes on, we have to grow with society. Everybody is facing phone. Even right now, I have my phone right here. You know, we don't ever really keep our phone nowhere further than 5 feet from us. So that's the best way to advocate to people. So, you know, we do a good job at promoting using billboards. I think we're doing away with a lot of paper ads, just in general. You know, a lot of times if you want somebody to know something, you're going to put it in their face. You're going to do it over the phone. So social media is a great way to go ahead and get that out.
Okay. And how do you collaborate with other organizations to enhance healthcare access?
I love that. Collaborating it's in what we all do. And so a lot of times we can collaborate, whether it's with sport organizations. It's all about being able to give and receive, if you will. We collaborate by ensuring that first off, we have a number one, priority and goal, and that's to bring our community together. Mm-hmm. So it brings us back to the topic of community. So we use, whether it's our local baseball team or local high school football team, the best way to go ahead and pair up is to ensure, for one, we're here for our community. Help us reach out to your audience so they can take care of themselves. Let's go ahead and drop off a few pieces of knowledge of how to make sure that you're up and well and ready to take on the day. So when it comes to partnering up with these community organizations, we ensure that, number one, we have the same goal, and that's to make sure that our community is well and safe.
So what role does technology play in improving healthcare access?
A huge one, very huge. I think even now we face a challenge with AI being here, artificial intelligence. It has posed a great benefit, but also a few challenges. It's hard to know what's real and what's fake now. But when it comes to electronics, it's the way that we're able to keep up with the changing span of healthcare. EHR, you're going to hear that a lot, right? And that's the electronic health record. You're going to be able to keep up with your patient's data just by ensuring that you're using systems like Epic. And this electronic, this system, this software, it has a whole world of your patient inside of it. It is a preventative care, so thanks to programs like these EHR systems allow us to be able to not only fill a care gap, but kind of see something before it hits. It allow us to track, patterns of maybe high blood pressure for sure, and maybe some poor habits, depending on what the patient may be sharing. It is preventative care. It is the preventative care tool kit that we all use.
Okay. So how do you measure the effectiveness of your initiatives to improve healthcare access?
Well, we measure a lot of our effectiveness based off of metrics. So depending on how we're reaching out to our patients, or how we're reaching out to different healthcare facilities, we measure our success by looking at the growth of progress that we are trying to make, or that we are making. I'm sorry, that's a better way to put it, not trying to make. So a lot of times, we have where you'll probably hear HEDIS measures, right? Or you'll probably hear guidelines that are put out from CMS, and that's the Center of Medicare, Medicaid.
Mhm.
So a lot of times, in order to see that we're doing a pretty good job, we have to actually look at numbers of improvement. So
Mhm.
whether you're reaching out to a certain amount of patients in January, and we want to see if we've improved here in February, what we're going to do is not only push out that, hey, this is the action that must happen, but we measure our success by using metrics.
Okay. So tell us, what are your future goals for improving healthcare access in your community?
I want to see more younger people. And I'm not just talking younger people in the community. I want to see more young healthcare leaders.
Mhm.
It 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 doesn't end with senior leaders. You know, I think in order to get that experience level um, that our senior leaders in healthcare right now have, it's time to put a little trust in younger leadership. And I think we got to start doing that a little early. I think the younger generation is more in touch with how to connect now. So I'm sorry, we got a little lag here, so it may be my computer connection, but I just noticed that a little bit. But that's what it's going to take. It's going to take putting more younger people in the seat to have that impact and to make that impact. We have to trust uh, that that's what it's going to take to make the change that we want to see.
Okay. So now we're going to transition over to preventive care. You kind of like hit on that a little bit, a few questions ago. But tell us, why is preventive care important in healthcare administration?
Preventive care is we can't avoid going to the hospital. Sometimes you just can't stop it. However, understanding how to prevent certain things such as hypertension, um, such as the low cholesterol, you have to be aware, and that's what the primary care physician is going to do for you. Finding a local physician in your area, a doctor's office, and just kind of being educated on your body is what it's going to take for you to make that change. So it's just, you got to be aware. And so preventative care is awareness, in order to go ahead and getting and understanding how you can maybe overcome a certain situation. For example, my wife had diabetes. She was pre-diabetic and didn't know it until she went to our new healthcare provider. And uh, it was another visit that she went to, and they said, "Hey, it's looking like you're on the scope of full diabetes." And it was like, well, it could have been prevented. Have I came to these appointments a little bit more frequently? More so, it could have been prevented if we had a better care team who knew how to advocate my needs and what I could have changed. So
Right.
preventative care is all about, first off, let's be informative. But to get that information, you got to be willing to take yourself and put yourself in a position to hear that information.
So, how do you promote preventive care among patients and the community?
I love that question. So to me, it's two ways to do that. One has to be voluntary, which is I'm going to be in your community, I'm going to talk to you, and then you just have to want to take that knowledge. The other part of that is that we got to be a little forceful. As the healthcare organization that knows what you need to do, we have your chart. If you have not been to a primary care doctor, however, you've been to urgent care, and they say, yeah, this patient looks like this is somebody I would like to go and see a primary care doctor a bit more commonly. I would advocate that those care teams need to go ahead and schedule you that appointment by making sure they, for one, get in contact with you and say, "Hey, I'm going to refer you to a primary care doctor. Let's see how you're doing. Let's see how you're holding up." Sometimes we need that reminder, but it's a two-way street. So, for those who want to hear that information, we want to reach out to you in your community. For those who are not quite thinking about it, we want to get somebody on your phone line letting you know, "Hey, it's time to take care of us. Let's go."
Mhm. Um, what are some common barriers to preventive care, and how do you address them?
Well, We got a few different barriers. The main one is the one that we can't prevent, which is if it runs your genes. Um, I was just actually kind of writing about this on the assignment, but after years of doing the wrong things from generation to generation, whether it's not going to primary care appointments and taking care of yourself, you're going to develop a gene pool that is going to impact your children. And it's nothing they can do about having hypertension issues. It's nothing they can do about having certain cancer cells, biting at their body. So a lot of times we have to remember that we have to educate our team and our family and our teammates on how to do a better job at, first off, going to see about themselves. And secondly, we have to ensure that we remember we got little ones that we got to take care of, right? Our children are impacted by what we do. My uncle, high blood pressure at some point leads off into me. So we have to, if we don't want to kind of injure, as I would say, the health of the up and coming generation that we're bringing into the world, we got to take care of ourselves. In addition to that, we also have to make sure we're more involved in taking care of ourselves. That's where it starts with. You just have to make sure you put yourself in a position to where you are looking out for you and you're looking out for your children. And so to prevent yourself from being in a situation where later on down the line you're looking at a hypertension issue that you just really can't do much with, you have to, for one, get educated by a primary care physician and just get to learn a little bit more about yourself and those genes in your family and how you can go ahead and make that, if not irreversible, how you can at least make it better for your family and yourself.
So can you share an example of a successful preventive care program you implemented?
So right now we're doing a A3. And if you don't know, A3 is a lean tool. It is, and it's a current project that we're doing now, but it's a process improvement tool that we use to, for one, identify a problem that we're currently having in our process and how we can use changes in this process of what we can eliminate, what we can add in order to get ourselves where we want to be. So we're doing an A3 in using macros and smart phrases to pretty much speed up the care given in our care facilities. So macros, for those who are unaware, in the EPIC system is pretty much a template that allows you to complete a Medicare wellness screening or a PHA screening, which is a depression screening. We try to find a way to help you push these screenings out quicker. That way you can go ahead and get your patient over to their physician, get them seen a little quicker. And it saves more time and allows us to see more patients quicker. So if we're not spending 20 minutes filling out a survey, that's a good day.
Okay. So how do you educate patients about the benefits of preventive care?
Well, for one, we do it during our appointments. We do it during our appointments. I know you've probably been to an appointment where you've received a pamphlet about how to manage certain care gaps that you might have had. It is the healthcare industry way of letting you know not only are you aware of where you might have fell short at in certain care areas, but how to make sure you improve it and how to make sure you're continuing to stay up to date with it. So we ensure that we inform our patients verbally, and we also make sure we're sending them home with information that to avoid going into a negative decline.
Okay. So what role do healthcare providers play in promoting preventive care?
They play every role. It is our job, no matter if you are the front desk receptionist, all the way up to the CEO. Our job is to ensure, and a lot of people say, well, if you prevent care, you probably have a little less patients coming in the door. And what does that do for you? But at the end of the day, preventative care that is successful means that you have more trust in your physician, in your care team, and you're coming back. We got to address the fact that we're losing a lot of people's trust, with the COVID situations that's been going on, and we've lost a lot of trust in the healthcare field, and it's not necessarily anybody in our field fault. Maybe we're losing trust because some people are just sick of being vaccinated and still at the end of the day probably getting sick. We have to find a way to educate our communities as we're learning to educate ourselves and our teammates on what that's all about. So we're still learning, but we have to gain the trust. And to gain your trust, we have to ensure, for one, we're in the fight with you, and we are transparent with you, and we're right there every step of the way. So transparency is a huge thing. I believe we need to account for when it comes to ensuring that we build trust in the healthcare industry.
So how do you ensure that preventive care services are accessible and affordable?
I like that. Speaking from our organizational standpoint at Atrium, we have a charter bus that goes around our community and does mammograms. So it's just great able to, if you can't get out and come to us, we're saying we're going to come to you and we're going to help you receive this care. We have also a dental bus that goes around, and although it's not with our company, there are companies out there that make sure that they get out there and that they come to you, whether it's at your job location, whether it's at your local community center. They're trying to find ways to get to you to ensure that you're checking in on yourself, that you're just tracking what's going on, that you're able to see them out in your community. It starts there, it ends there. It starts our community and it ends with our community.
Okay. So what are the most effective preventive care strategies you've seen in practice?
So I've seen a little bit of this last week. I was working with a medical assistant, and we do a lot of shadowing. And she had the opportunity to go in and speak to a patient. And she caught something on a patient's chart and let her know, hey, I think it'd be a great time for you to probably schedule this type of appointment. And let's go ahead and also get you scheduled for this type of appointment, whether it was a cervical cancer screening, whether it was, hey, let's, get you in and let's try to get another blood pressure check for your next upcoming appointment. Our medical team ensures that our patients are not only just family members and they're, that they know that they're with someone and they're in the care of people who really care and really appreciate them. You feel the love at our company. You really do feel it. And so I had the opportunity of working with just a wonderful, outstanding care team, and they really do go above and beyond. I mean, if we have clinicians who knows their patient's chart front to back, and they don't have to open up the health record. They know their names. They know about the husband or the wife who might have passed a couple of years ago. They know about graduation dates. They know it all. And they know how to approach each and every patient with just care and love. And so I think that had a huge impact on me. And being new into healthcare, I got to tell you, that right there definitely changed a little bit of what my intake was of healthcare. And that was that it's an industry that we're here to help, but at the end of the day, we have a job. And it's all about our job. Hospitals are so clean, so sterile, even urgent care, even primary care, of course, because they have to be. But it just feels like when you're going in there to kind of get it over with. But to that care team, they're going to try to make you as comfortable as possible. From ripping off that sheet of paper that goes over that bed that you're going to lay on, they're going to ensure that they're having great conversations with you. They're going to check in and see, how's the baby doing? How you feeling? Are there any concerns? And when they're asking those questions, they mean it. They want to know. So I worked with a wonderful team last week, and it's really just it's more than a mindset. It's just a company. It's the heart. It's the core of who we are.
Well, I'll tell you this. That definitely, when it seems like, especially in healthcare, where you know your patients' really, really well. To that point, it's almost like family. And so that, those are very intimate moments. I think that mean a lot to a lot of patients. And that is how you create the loyalty and the trust, when it comes to healthcare.
That's absolutely right. We got a great team, and being there, I had a chance to kind of also follow around our whole team. So from working with the practice manager to working with the front desk, you felt it. You really did feel it. They knew patient's name without even opening up the medical chart or putting in those. They knew who they were talking to. And so, like you said, it really is a family thing. I don't know if all patients get to experience that or maybe even notice that it's happening, because some patients are like, hey, I'm here to get it over with. Stick me. I'm here to get it over with. Let's go. At the end of the day, you're cranky patients and you're having fun with them. The sweet ones that you can, just talk to. And before you know it, you'll be in a room talking to a patient for about 20 minutes. And haven't probably gotten half of what you needed to get done because y'all are just having such a great time. And so it's just, I love to see it when I do see it.
So how do you stay updated on the latest trends and research in preventive care?
Well, we got a team especially just lined up for that. I'll tell you, if you would have asked me the question about a few years ago, what do I think healthcare composed of? I would have told you it's the hospital, you got your clinical staff, and then you got administration. I would have told you that administration was just your CEO, maybe a department manager, and you probably had two departments, billing, and you probably had marketing, and it's really, Charles, to break down healthcare to you, they got an extraction team that extracts, bad charts and make sure that they're reaching out to the patients to ensure, hey, look, you got some care gaps in here we need to fill up. We literally have a team that is looking for patients who needs to get up and go see a primary care physician and see about themselves. We have a marketing team that gets out there and they promote services to kind of bring us to the question of our marketing team is pushing out each and every day, hey, come on, let's go ahead and push out some flyers. Let's go ahead and let's get to those schools. Let's get on campus. Let's go to the work site, the job site, and let's let them know, hey, here goes the flyer. Come and see us. You don't have care, don't worry. Here's one avenue you can explore. Just come get seen about. We had a patient, and it happens often, but we had a patient who had a tab, that she didn't pay from her last visit and was getting ready to pay it. And they said, well, it's no rush. Just come get seen about, and we'll have. Sorry, I hit that mic. But without paying for the service, she was able to come back and she realized, it's not all about the money. You guys aren't rushing me to pay this tab right now. No, come get seen about. That's what you're here for. That's what we care about, and we'll handle it later. So just having that is beautiful. But our marketing team does a really good job at ensuring that we're pushing out ways that those who are uninsured to be able to come out and feel that it's not that you don't have to be under an insurance care or have to be under any kind of insurance, and in order to come see us. There are ways that you can pay your tab. There are ways that you can pay some now, pay some a little later. So there are definitely ways, and we have plenty of people who at our primary care centers, in urgent care and all, who can advocate with you about routes to get that done.
So what are your long-term goals for improving preventive care in your organization?
Well, long-term, we want to make sure that we have every single individual up from our janitors to our marketing team or, whoever's working in any organization that I'm a part of. I think one team, one sound. So we want to make sure that we're educating our teammates on how to get out there and educate others on how to take care of that primary care. We're all advocates. We are all advocates. That's the best way to put it. And so we have to go out there and let people know the big mission behind making sure that you are going and getting that preventative care, and let them know that at the end of the day, it impacts not only your family, but it impacts your community. You may not think of it now, but if one of us were not to wake up tomorrow, a whole lot of things shift. A whole lot of things shift, and those shifts are the most painful, just life altering, rupturing experiences you can never imagine. And if we can go a day longer without that, we really do the community, our families, a whole lot of good.
Let's transition over to the regular doctor visits. And if you can tell our audience, why are regular doctor visits important for maintaining good health?
Well, it's kind of all in there. So if you're going to a primary care appointment regularly, you get to be updated with your health. You know just as much as the doctor knows. You don't get no surprises. If you go every day, you know I'm sorry, not every day. But if you go frequently, you know how to make sure that you're taken care of. So it's all about being in the know. Things change. They have it now to where you have these ways to track your A1C in real time. I mean, I've seen devices. I'm talking tiny. You put them right here, or wherever you want to put it, and you go out to Cracker Barrel, McDonald's, or whatever, and you have you a little bit of too much sugar. That thing will get on your phone and it'll beep, and you're like, oh man, I better slow down. That's the part. I better slow down. And now it's because knowing is the battle in healthcare. It's the battle. So getting out there and making sure is how you prevent these things from hurting you, harming you, and putting you in any kind of prediction that you don't want to be in.
Tell us, how do you encourage patients to schedule and attend regular doctor visits?
You have to, in healthcare, we are working on ways to make sure that it's quick. I think the quickness is the part that the patient wants to know. A lot of times, if I'm not going to a doctor appointment, it's probably because I'm at work. And do I think my boss would mind if I go to an appointment that's under 30 minutes and I can get back to the office real quick? She wouldn't mind at all. If we can go ahead and kind of fit healthcare in the quickest way into a patient's schedule, and let them know that, I think we got a lot more people willing to do it. And that's where we are right now. I've seen appointments, 10, 15 minutes long. Now, that's relatively quick. And these are not urgent care appointments. These are your primary care appointments. This is the appointment that you've probably been waiting for, since last month, since maybe 3-4 months of waiting. But it only took 10 to 15 minutes and you're out the door. You know what you need to know and you're out. So if we can advocate to our patients and let them know, hey, coming to get seen about is a quick process. It's self-assuring, and you go on about your day, you know how to move forward. But I think it all has to do with speed. We want our information now. And so the same thing with care. We want our care now. You go to a restaurant, you want your food now. If we're quick, we're able to ensure people that, hey, this is what you want. And at the end of the day, I think a lot more people are willing to come up to those primary care appointments because they'll be relatively quick.
So what are some common reasons patients avoid regular doctor's visits, and how do you address them?
Sometimes we don't want to hear that bad news. We don't want to quite figure out that we've been eating a little too much fried foods. We don't want to figure out that we've had a little too many sweets. A lot of times, if you don't know, it don't hurt. But the bad thing about that is when it hit you and you could have avoided it. A lot of times, that's what it is. A lot of patients don't go to primary care. A lot of people don't go to urgent care because they fear knowing what's going on.
So how do you ensure that patients receive comprehensive care during their visit?
We do our surveys. There are surveys that our patients get every day. I don't care what care facility you are, you should be doing a survey. I don't care if it's urgent care, primary care, even the ER. You should get a survey. That survey lets us know what we're doing right or let us know what we're doing wrong. And it matters. those we have payers. These insurances pay our bills. So when it comes from your insurance, they say, hey, look, you had a patient who went and seen you the other day and they did not have a good experience, and it counts towards us. It could mean deduction in funds at time. It could mean, hey, the insurance probably doesn't want to continue to do business with you. Your insurance is your advocate, and just as much as we can be. But at the end of the day, we ensure that every patient is treated equally and rightfully to the way that they should and any human being would want to be treated. So it matters to ensure that we're giving great and quality care. We ensure that we send every patient a survey link, and they have the right to go ahead and let us know where we went right or where we went wrong.
So what role do regular doctor visits play in preventive care?
Well, going to see your doctor regularly allows you to pretty much be in a position of having that knowledge. So your doctor, sounds funny enough, but probably knows you a little bit better than you know yourself. We're only familiar with our moms knowing us that much, right? Maybe pops know us better than we know ourselves. But your doctor's another one you need to add on that list, right? They are Santa. They are watching you when you are, asleep. They're looking at those habits. They're aware of probably what you're doing too much of, too little of. So to understand that our doctors know enough information about us just by looking at our care charts, going to see that doctor regularly, they know how to guide you to doing the right things, to what to avoid, what to continue, maybe integrating some fitness in there, maybe integrating some food in there. It's all part of preventative care. Preventative care is literally, it's all in the name. What can I do to ensure I prevent myself from, having cancer eventually? Maybe I have a tumor somewhere. Maybe I am potentially, going blind. Things happen, and we're not always aware of them. Sure, it's our body, but we're not examining our body in a way that a doctor knows how to examine us. These are professionals who went to school and just know how to look for these clues of, hey, something's happening here, and you really need to pay attention. That is preventative care. So get you a primary care doctor, go get seen about, and let them help you prevent anything that could come your way. I think we froze up a little bit. Charles, I think we froze up just a wee bit. Let's see here. All right. No worries. But if I can share with the audience anything, one thing I do want you all to be aware of is that if there's anything stopping you guys from seeing a primary care provider, feel free to call. Just call up and set up that appointment. And we have advocates, not just at Atrium, but at any care facility. You have the ability to talk to someone for free and talk to them about why would it be beneficial to you to go ahead and get that care done. So it's essential that you know what's going on with your body, and it's imperative that you know how to improve the track that you're probably heading towards. Most of us are in actually pretty okay shape, and so you just probably want to know what you're doing right, and hear how you can continue going that route, and probably what you need to avoid to not ruin that winning streak. So that's one thing I would like to kind of share with the audience. I did have a few questions, not questions, but kind of some hints written down. But if we want to talk about things such as the role of trusting healthcare providers, as we've already mentioned, but how that can increase trust in our communities. When I push that out there, to me, having trust in your provider, in anybody within your care team, it doesn't have to be your doctor. Maybe you walk in and you go into a clinic and you see the front desk lady. She doesn't have maybe the best attitude. And so you're like, I don't want to talk to the receptionist and have a bad experience. However, that becomes a part of that trust barrier that a lot of us do experience, that sometimes the customer service is not what it should be. I want to still advocate and let you know that you should go and get seen about. Make sure that you do go and take care of yourself, and let someone know that your experience wasn't what it was what it should have been. A lot of times we have to realize that we have the ability to fill out those patient surveys, and they work. There's no better way to advocate for yourself than to get out there and push out what that service was like for you. So transformative care, it starts with you taking care of yourself. We can't talk about how to improve healthcare if we're not involved in the healthcare process. Okay, we can't wait until it's too late, and we have to ensure that, for one, we are letting not only community members in our community know why it's imperative to go and get seen about, but we also have to ensure that we are communicating with our care team, no matter who they are, whether it's your clinician, whether it's the woman or the male at the front desk. It could be anybody, but we want to let them know what that experience was. And that is how you pretty much build that trust. You have to continue to just communicate. You are your advocate. And we just ask that you allow us to advocate with you and for you when it comes to taking care of your health. Let's see, that was Ross Charles. Okay. But I see we're still going live here. Let's see here. Okay. So if we can, I want to talk about the importance of annual checkups. Even when you do feel like everything is okay, it's kind of all in there, right? You feel fine, but see, feeling can be one thing, but the reality can be another. Ensure that you are going and you are seeing about yourself, because anything could be the matter. You could, cancerous cells always, that you can have them and not feel like you are sick. Sometimes it's all about going to go see about yourself before it gets too late. I don't think that was put out there in reference to, hey, here's a scare tactic, right? It can all be scary. Healthcare is health care. You just got to remember the point of you going to go be seen on an annual basis for sure. Get those wellness visits in. Is to ensure that you're taking care of yourself and that you're in good hands and that you are in the know. You need to know what's going on with your health. You need to know how to improve it. I did want to talk on another topic about going to the emergency room versus going to your primary care, and why I would not advocate for you to go to the ER over a cold. Sometimes a lot of people, we go to the ER when it's too late for us to make it to that primary care giver's office, right? If you can't wait, that's what the ER is for. However, sometimes we can be a little dramatic, and I think a lot of times we tend to go to the emergency room for basic issues, and what it does do with it kind of jacks up the process that healthcare has laid out for us, right? The emergency room is for that urgent need of care. It's for those who are maybe going through a shock, any kind of trauma care. We don't want to slow up the care process that can be tendered for those individuals, or put you in a situation where you're waiting for exceedingly long time, just based off the cause that, hey, they don't have the time to kind of give to your care need due to it not being as significant as another one that they might have had come in. So you want to go and see your primary care doctor and get that seen about. And if you don't have one, call a local doctor's office and set up a primary care appointment. Other than that, you can go ahead and also call your insurance and see who they are in network with. If you don't have insurance, go ahead and figure out who can offer affordable care in your area and what options that you have that are available to you to go ahead and take care of yourself. So that is one thing that I wanted to make mention of. I'm sorry, team. I'm not sure if our host is coming back here. So I'm just going to kind of go down my list of things that I want to talk about here. Okay. So I have one written here. I want to talk about how a good relationship with your primary care physician can equal to just a great care plan and better health outcomes. Building that relationship with your health team allows you to, build more trust with the office, build more trust with your provider. It allows you to know a little bit more, feel a little bit better about going and taking care of yourself. Sometimes you just need to trust to let your guard down. It can be a little uncomfortable sometimes getting up there on that table. Sometimes it's cold, but they can't always make it as comfortable as we may all like. Sometimes I want to go in there and I want to feel a rug under my feet. I want it to be warm. But I guarantee you one thing. There are care teams out there who are dedicated to ensuring that you are comfortable, that you are receiving quality care. And the more that you go and you build that relationship with not only your clinician, but you build that relationship with the care team in the office, you're more likely to continue to come on back and just be comfortable. So I did want to go ahead and mention that. I did not want to leave that part out for sure. If we can, I want to talk about why honesty with your doctor about your lifestyle habits and symptoms is critical. We're not hurting nobody but ourselves. So we have to ensure. This is Charles here. One moment. Hey there.
Hey, I want to apologize.
Okay.
All right,
Can you
we're
hear
back.
me?
I can. How about me? Can you hear me?
Yes, sir. I can hear you.
All right.
So I kind of hate that I just had this internet issue here that just went down. Um, so um, so can you can you tell us? I know what we were actually getting. I was getting ready to go and transition into the the Black History part here because I know with February being Black History Month, and you were when I reached out to you about this, and you told me that you were influenced by Pastor John Lambley. And so what I wanted you to tell us about that situation is, how has Pastor John Lambley influenced your career and leadership style?
I'll tell you, Pastor Lamp is just he's an outstanding, first off, pastor, but above that, an individual, a loving husband, father, and a great leader. It's just I believe that's who we all aspire to be like. I had a privilege of meeting him. I want to say in the middle last year. I was running for Bartow County District 4 School Board, and he reached out to me and just really just kind of gave me some great influence. And he just told me no matter what happens, stay in the race. And it just gave me great guidance. And he was the very first one truly in the community who reached out to me. I've always reached out to people in our community. He reached out to me. So he asked me, hey, you let me know what I can do to help you out. So I love that. You don't really hear a lot of that anymore. Or at least that was my first time experiencing that.
So can you share a specific example of how Pastor Lambley's teachings have impacted your work?
Absolutely. So he's a minister. And one of the main things, there was once a sermon he did, and it was all about, for one, holding ourselves accountable. It was the very moment that I actually joined the church, but it more so captured the fact that other than your education, other than your certifications, when you get up in the morning and you do whatever you do from the day in and day out of your life, we got to remember to give praise to God. Everything that you do, everything that you do is influenced by and is allowed to be done through the Lord. It's not that I didn't know that, but sometimes we need that reminder. A lot of times I have that moment where it's just I worked hard for this. I put myself through right now. I put myself through a doctorate degree in healthcare administration, and we got to remember we're doing all of this through the Lord. That we are blessed to be able to wake up another day to continue such an amazing journey, and so He helps us hold ourselves accountable and just say, "Hey, don't ever forget that you are blessed to live this life. You are blessed to wake up. You are blessed to just be able to be in the same room as other folks. You are just to have this opportunity. It's all given to you by God. So sometimes we need that reality check. And I enjoyed when he gave it to us. I think it was an eye opener, and I heard it as we all hear our messages in church at the right time.
So, what lessons from Pastor Lambley's life and work do you apply in your role as a healthcare administrator?
Hard work, and one thing about him, he's like me. He needs something to do, and I can tell you right now, he's always looking to join a program or a community event, and no matter what, he's all about education. He loves to learn, but more than that, Charles, he loves to teach. He loves to teach. It's going to take me some time to get to his level of teaching. He can sit down and talk to anybody from the ages of being a 4-year-old on up, and your attention is just locked in on him because he is just a wonderful messenger. And I said it. I said, you have a gift with words. You know how to connect. And just having that connection is really what it takes to be a great leader. You have to be able to understand how to relate. And I feel like he can relate to those that a lot of times you probably think you couldn't relate to. It's hard to relate to a kid and have a wonderful honed in conversation. But he does it all the time. I want to say 2 weeks ago, he talked about a young African American young man who approached him, and he said, "How you doing?" He said, "I'm doing good." And he said, "Okay." He said, "What have you learned during this Black History Month?" He said, "Well, I learned about Martin Luther King." He said, "Okay, tell me, what did you learn about Dr. Martin Luther King?" He said, "Well, I learned that he got shot." He said, "Oh, okay." He said, "Well, what else did you learn?" He said, "Well, I learned that he also rode the park. Also rode the bus with Rosa Parks, and then they went to jail together." And he said it seemed like either you heard what you wanted to hear, or his work, wasn't magnified enough for you to really hear all of his works. And so, just after during the sermon, he was just he laid it out of how he was just educating the young kid, and just was like, I couldn't even get into it, but the way that he told us that interaction went and how he educated that young man, when he got done talking, he said, "Wow, can you tell me more?" And he kept going, and he goes, "Wow, who else is there?" He wanted to know more. So it just all goes to say, he's a wonderful storyteller. Give me that gift. I'm waiting on it. I want to learn how to communicate just like that. And if I'm blessed enough, I want to try to see if I can do a little better. He's wonderful.
So how do you honor and incorporate Black history into your work and leadership?
I'll tell you, the organization I work for does it for us. They don't, even right now, we still have our Black History banner up on our website at Atrium Healthcare.
Mm-hmm.
But I believe at my level, I make sure that I can share information of what's been put out there. And so I mentioned earlier, I love getting on LinkedIn. I love getting on Facebook. I like to share the work of African American inventors. I love to share poems. I love to sit there and recognize current healthcare executives that are just really knocking down barriers for us to kind of come through that door. So the best I can do is help be the megaphone to what's already out here and share that information.
Now, I think when it comes down to Black history, because it's in depth and it goes all around the globe. And so, and just thinking about the many creators, the foundation and founding, of this nation as a whole, how does that play, when it comes to, you being the one of the newer representatives in your company in healthcare, when it comes to just historical facts in general, when you just want to talk about some things? Do you ever get that opportunity to do that?
I haven't had the opportunity quite yet to be able to go out and speak and be able to share some impact quite yet. I'm very early, 2 months in, but I know that time is coming. I'll tell you, our CEO is an African American, Eugene Woods, CEO of Advocate Health, which is over Atrium Health Floyd, which is where I work. Mm-hmm. Let me tell you, you're talking about a visionary, a doer. He is a doer, and it takes great leadership like that to create great leadership just like that. He's doing a wonderful job, and I'm not just saying that. I mean it. you can kind of feel impact from the top at our level. And it allows you to have that amount of impact, probably not on that same scale. However, we got impact. And oh man, you're talking about knocking down the wall with the hammer, and being able to pass that same sledgehammer down the line to your team. That's what our organization is full of. It's full of that. So I'm glad to work for such an amazing company. I didn't know our history of in our leadership when I applied, but just working there, getting to know it, I'll tell you that it's definitely opened my eyes up, and it's made me a little just really grateful, and it kind of showed you there's not one thing you cannot do.
So, what role does faith play in your approach to healthcare administration?
Faith. Faith is huge. It is a process. It's the process. It is the trust. If you got faith, that word alone is a foundation of. It's the foundation of what keeps you secure. Mm-hmm. I believe faith plays a huge role, and I know all of our teammates have it. With hard work, mm-hmm. we got faith. It plays a huge role. Faith is our motivator, and to kind of get into it, if I can kind of break down what faith means to me, it means no matter what, we trust that the end goal is going to be for the better good. And it's going to all work out in the favor of the good that we're trying to imply. It's just knowing that God is on our side and is our ultimate leader. And that's what comes to me. That's faith. Just believing in the process and seeing it through. You got to see it through.
So how do you address health disparities in the Black community?
Ensuring that we have clinics everywhere. If you ever come, and you probably definitely have heard of it, and that's just another part of being able to work for such a great company. Atrium Healthcare is all throughout Georgia, Alabama, South Carolina, North Carolina. We are everywhere, and it started off by ensuring that we were in the areas where healthcare was not as accessible, in the past. Our organization it planted its roots in the most impoverished areas of our state to ensure that we were pushing out equitable care, that you receive the same care as your counterpart. They don't discriminate and did not discriminate based off of race, based off of sex. It was a human right. You got the care that you deserve to get, and it just didn't. It didn't shy away from what anybody else was getting at all. So the company was literally founded based off of making sure that everybody had the same entitlements to care. So seeing where we are now, it's a great place to be.
Can you share an example of a community initiative inspired by Pastor Lambley's legacy?
A community initiative that was inspired. I'll definitely tell you a community event that we were a part of, that he was a part of, and he is a part of the fraternity Omega Psi Phi, and just being a part of such a prestigious and amazing fraternity who is just embedded in the community in Rome, Georgia, and throughout Cartersville, we had a privilege of doing a community gathering for a Martin Luther King celebration ceremony, where together we had just a handful of schools. There was a dance performance. There was a breakfast. It was practically like church, and the building was so full that I could barely. They had to make additional tickets after they sold out the tickets because they didn't want to turn anybody away. And I was one of the individuals because I called pretty late. But his role in the community is ensuring that for one, that we're all on the same page, that we're all in the know, and that we're all aware.
So how do you engage with the Black community to improve healthcare outcomes?
Could you ask me that question one more time?
How do you engage with the Black community to improve healthcare outcomes?
I believe educating our community is the best I've done so far. Being pretty new in the seat, I've had the ability to be able to reach out. I've definitely had the chance to push out things such as internship opportunities with our organization. And throughout Black History Month, a lot of the posts and things have gotten a lot of attention. I'm sorry, I got the little baby here, but it has pushed out. I'm sorry. All right, go upstairs, please. Thank you, boo. Sorry, mom was supposed to be watching her, but they being able to have that kind of impact, to be able to be a part of an organization where I can push out information like that. I'll tell you, I've been able to do a lot of mentoring, and a lot of African American males I've had the opportunity to mentor. But not only that, I've mentored everyone who's been able to come to my route and come into the same space with me. I've been able to mentor, but I've had the privilege of being able to kind of look in the mirror and see myself in so many young men. I've even been able to mentor young men who are older than me. And so it's just being able to kind of get a chance and remember that we also have to remember how to keep a door open, and not just for African-American men and not just for African-American women, but for all. But being able to be in this position, we have just a great impact on each other in the African-American community. So if they see you doing it, they know they can do it.
So what are your thoughts on the intersection of faith, leadership, and healthcare?
So to me, it all goes hand in hand. I'm very religious. So when we say, faith, to me, that's my belief in God and just guidance of the Lord. Not everybody's like that, but I believe in order to rule and to be able to lead, not to rule. I'm thinking more so in terms of in the Lord. But in order to be able to be a great leader, you have to you got to believe that they're the head, and Lord is the head of our household. He is what keeps me grounded and keeps our family balanced. And with that, it allows me to go to work, a clear mind, and just know that all trust and faith is within Him. So that's kind of what faith is to me. So having that, something to keep me grounded, to keep me as a foundation of my family, I think that's what creates a great leader. Somebody who understands that there is a higher, a higher power, and that leadership is to ultimately follow and be the image that we want to see and we want to follow. Mm-hmm. So I think it for me, it has kept me fair. It has kept me open. I'm compassionate. I am just kind of always looking out for our teammates, as I know I would want somebody to look out for me. So it ensures that no matter where you are in leadership, you're a human being. We all put our pants on the same way. Mm-hmm. We got to also make sure we're considering what our teammates are going through. So you got to be a considerate, compassionate leader. I think that's the only kind of leadership that wins.
Okay, and this is coming to our conclusion here with this last question. Is how do you ensure that your work aligns with the values and principles of Black history and Pastor Lambley's teachings?
I love that question. I love that question. What I do to ensure that I'm leading in a way that Pastor Lampley would love for me to lead, and leading in a way that I know those who have provided and paved this way for me, is I gotta give up. I gotta make sure I'm doing a good fight. I gotta be committed. So whatever I do, I'm not going to quit. No challenge. I'm not going to quit or shy away from a challenge. I'm going to ensure that I lead the way, and I'm also going to make sure if I am in a position to follow, I'm going to follow faithfully. I'm going to ensure that I make sure I'm protecting those behind me, and I'm going to ensure that I'm doing my best to, if I can, protect those in front of me. So it all goes back to that, that faith. I have faith in God to ensure that He protects me and lead me on my journey, whether that's a journey of leadership, whether that's a journey of whatever pathway I may go when I'm driving or if I'm whatever. I just know I have faith in God, and those who have faith in me, they got faith in someone who's reporting to somebody of just a higher power, and it just doesn't get no better than that.
So in closing, what is it that you like for our audience to know, and particularly about the healthcare industry, healthcare, your perspectives, how they can connect with you, your socials, anything you'd like for them to know? Can you please give us some closing words?
Absolutely. What I want the audience to know, the bottom line, is that we need more people in healthcare. We need more. It's not oversaturated. We need you. It starts with healthcare and it ends with healthcare. More than that, we need people who can help us be better advocates. The way we need to communicate with our community now is it gets a little challenging. And to be the heart of the community, we have to be able to be everywhere and somewhat nowhere at the same time, if that makes sense. We're trying to be in the heart of our community without trying to shove everything down their throats and make it seem like such a forced message. The bottom line is we need to be able to advocate to our community how to take care of themselves, how to take care of themselves, how to put themselves and their family in a better predicament to be ready for what's to come tomorrow, and to just be in a know. To not be afraid to go to their primary care physician. Don't be afraid to go and see about yourself. Let's cut out going to the emergency room for things that our primary care physician should be looking at. Let's make sure we build a regular care routine so that our healthcare system can properly work the way it's supposed to work for us. I believe if we're not using these tools to the best of our advantage, then we're only hurting ourselves. Also, I want to be sure that another message I want to push out is that you need to get more younger people in healthcare. I don't care if it's whoever, we need to get more younger people involved in healthcare administration, more younger people involved in getting in healthcare is changing by the minute. Right now, we're going to log off and go to sleep. But I guarantee there's somebody up right now looking for the next big thing that's going to help push our community forward to healthier lives. And that team is looking for you. So no matter what, I think we need more younger people involved in how to improve quality care in our communities. For those who want to follow me, Amari Johnson is usually just the best way to find me on any social media platform. I'm on Facebook. If you're looking for me on LinkedIn, Amari Johnson, LSSBB for Lean Six Sigma Black Belt is how you can find me on there. So, Charles, I want to say thank you for having me. And I want to say thank you to your audience for just being that listening ear. Feel free to reach out to me. If you're looking for internship opportunities, although I can't promise any, I would love to send some your way. If you're looking to be just a mentorship, I'm looking to help you with that as well and kind of help guide you in the right direction. It doesn't matter what age you are, young, mature, it does not matter. What we want is we want you in healthcare, and we want you to help us continue to provide quality care to our communities here in Georgia and throughout the United States of America and around the world if we can continue to push that mission.
Well, I appreciate that. I appreciate you for being here, and I also want to apologize to you and to the audience as well because of the internet failure that caused a long delay. I really want to apologize to you all for that because that came out of nowhere. But I want to tell you that we definitely have to have Amari back because tonight's topic about healthcare is something that's really meaningful, and it's for all communities. And I know we target underserved and marginalized, but we want to make sure that we get people to understand not just what healthcare is, but what it does. How to access it, to learn about preventive care, and whatever else is necessary, because we want you to make sure that you're doing what's necessary to maintain your livelihood and to live as long as possible. For those of you that were watching on the YouTube channel, if you have not, we would appreciate your support. If you would please subscribe, hit the notifications button, and you'll be able to catch each and every show live. Or you can go back and watch as many of our previous shows as you'd like. Catch up, follow the hottest podcast in America, and stay up to date with all of the wonderful information that we will be providing from today going into the future. I want to thank you again, Amari, for being with us. We definitely have to have you back. And also, I want you and everyone that was watching tonight to have a wonderful weekend. Join us again next week as we present more and more great shows of America in black and white. Thank you again, sir.